Go straight.
It is having what? Right. Okay. Along with this, I also wanted to add. I also want to add another structure just here.
Wildlands
Behind that,
rectum.
what the rectum coming as anal canal, right? So this is the rectum with the anal canal, okay? And behind that, you know very well that there is some structure called as the sacrum and the coccyx, right? Sacrum and the coccyx with the S3, S4 and S5 vertebrae. So S3, S4 and S5, and this is something called as coccyx. I am using only a letter C to indicate the coccyx, right? And also now at the tip of this coccyx, you already know that there is one element called as the anococcygeal ligament, right? And also I wanted to keep a fascia here.
Devilus.
As it is a male pelvis, it's called as fascia of lunar region, right? And also I wanted to add some more muscle here, which was like pulling the rectum anteriorly, called as what? It is called as the pubis muscle. Okay, of course in the front I just wanted to keep this structure to make it more attractive. This is called as the pubic symphysis. Now our discussion is about the anal canal, right? So now I just will so now I just wanted to take another diagram here. That is, like the female pelvis. This is the female pelvis, right? With the urogenital diaphragm here. Okay. And also this is the perineal body. Now I just wanted to keep some structure here called as what?
Uterus.
Uterus with the cervix, and this is the anterior vaginal cortex. This is the posterior vaginal cortex. And behind this is now our important structure of uterus, which is called as what? The anal canal. So this is the rectum, and this is the anal canal, right? And behind that, you see the same structure again called as what? The sacrum with the coccyx. And this sacrum S3, S4 and S5. S3, S4, S5, and this is the coccyx. And also want to keep the same structure here called as the anococcygeal ligament. And I wanted to draw the same structure, that is the pubis muscle, like this. And in front I just wanted to keep the pubic symphysis, right? Okay. So now like again I've drawn the same diagram, that is the pelvis of sagittal section of the pelvis of a male and also the sagittal section of the pelvis of female, right? Both are here. Okay. So I will label them later on. Okay. We will label them later on. Now our question is about the anal canal, right? The topic is about the anal canal, which is very, very important for us. The thing is, right, the anal canal extends from the level of, you know this name of this belt called as what? So it extends from the level of rectal ampulla up to the level of, like the anal opening. So that is the extent of this anal canal. So with this, what I just wanted to keep is, so if I draw a line from here to here, this is the extent of anal canal, which measures approximately 3.8 centimeters long. It measures approximately 3.8 centimeters. This means that the length of the anal canal is 3.8 centimeters. Right? Now I just wanted to focus on this bend, right? This bend. Okay? So at this level you can see that the anal canal on the posterior side, it is supported by the puborectalis muscle. Am I correct? Because the puborectalis is pulling it front. But if you see on the anterior aspect of this anal canal here, it doesn't have any support at all. So this is the region where the anal canal is weak because it is not being supported by any structure, right? And now coming to the next part, that is about the relations of this anal canal. It's very easy to understand. Please remember that in the next coming diagrams I am going to show you the lateral relations of the anal canal, but anterior relations I am just going to write here the anterior relations of the anal canal. Anteriorly, okay, anteriorly I am just writing it as what? Males. Okay, in case of males, the anterior relations are this one called as what? Denovilus fascia. This is called as prostate. This is called as urogenital diaphragm, right? And this one, I just wanted to focus on this. This part is now called as the membranous part of urethra. Right? This is called as the membranous part of urethra. And also I wanted to write this one here as the perineal body. Okay? Perineal body. Now coming to the relations, anterior relations of the anal canal in case of males is, that is first of all I write it as what? Denovilus fascia, right? And also it is related, this anal canal is related to the lower part of prostate gland, right? And also this anal canal is related to the perineal body, am I correct? And this anal canal is also related to the urogenital diaphragm. And finally, it is also related to this one called as the membranous urethra. So these are all the anterior relations of the anal canal in case of males. But in case of females, I write it here. In case of females, what are the relations? You can see it's very visible clear, right? In case of females, the anal canal is related to posterior vaginal fornix, and then comes what? The perineal body, and then comes the urogenital diaphragm. So this is the difference between the anterior relations of anal canal in case of males and females. Okay? Of course, the posterior relations are the same in case of males and females. So simply I am writing it here that posteriorly the anal canal is related to only two structures called as this green color structure called as anococcygeal ligament. So I am writing it as it is related to the anococcygeal ligament and also to the coccyx. Okay, these are the only two structures which are related to the posterior surface of the anal canal. And now coming to the lateral relations. On either side of the anal canal, there are only, there is only one structure which is present on either side called as this one called as the ischiorectal fossa, or you can even call it as the ischianal fossa. These are all the relations of the anal canal, right? And now coming to the interior of the anal canal, which is important for us, right? Because like many conditions called as, especially called as hemorrhoids, right? Hemorrhoids. So now coming to the interior of the anal canal, I just wanted to draw this anal canal in, I just wanted to take it in different color. I take it brown. I take it brown. So coming to the interior of the anal canal, here you can see important structures which you can see here. I am just drawing the interior of the anal canal. I am just trying to draw the interior of the anal canal. Now you can see this is the rectum, recto-anal junction. from here now the anal canal has started, right? Now this is the anal canal with one, like border, and this is the second border, right? So now this is the second border, right? This is the anal canal. So let me, like make it little bold so that you can understand, okay? So I just wanted to make it bolder. So now you can see that this anal canal, what you are seeing, is now basically divided into two parts, upper part and a lower part. Clear? That's why I have kept two lines, right? Upper part and a lower part. Now coming to the upper part of the anal canal. In the upper part of the anal canal, you will be seeing the innermost layer of the large intestine is what? The mucosa, right? The mucosal layer. This mucosal layer at the level of this upper part, in the upper part of the anal canal, forms nice folds like this. You can see these folds. These are the folds. What we are seeing is the folds which are being formed by the mucosa in the upper part of the anal canal. Am I correct? So these folds which are formed in the upper part of the anal canal are called as the anal columns of Morgagni. These are called as the anal columns of Morgagni. And there are approximately 6 to 10 anal columns of Morgagni. So how many anal columns will be seen? Approximately 6 to 10. Okay? Right. Now, this upper part in the anal canal is now further subdivided into two zones. That is an upper zone like this, a middle zone and a lower zone. So the upper zone, now you can see the length of the anal canal. What is it?
3 to 8.
3.8 centimeters, right? Now the upper zone measures approximately 1.5 centimeters. The middle zone measures approximately 1.5 centimeters and the lower zone will be approximately 0.8 centimeters. Is it clear now? So this anal canal is finally divided into three zones: the upper part, middle part and the lower part with their measurements, right? And now you can see that this is the rectum, this is the upper part of the anal canal. Now I said that these are nothing but the anal columns of Morgagni, right? And in between these anal columns you can see some space, right? Right? Can you see this space? This space which is present in between these two anal columns is called as the anal sinus. Anal sinus. So I'll just write the name here as the anal sinus. So these are the spaces in between the anal columns which are called as anal sinuses. Now coming to the important part, that is the lower part of this anal columns of Morgagni. The lower part of the anal columns of Morgagni will contain, like transverse mucosal folds like this. Transverse mucosal folds like this. And these transverse mucosal folds which are lying at the lower border of these anal columns of Morgagni, they are called as, with one special name called as the anal valves. Or otherwise, you can also call these anal valves as with separate name called as VALVE, valve of Ball. Otherwise, you can also call it as valve of Ball. But see, once if you look at an individual one, this is one anal valve, right? This is one anal valve, okay? But if you look at all the anal valves, right? Now if I just wanted to draw a line like this, okay? These all anal valves together will form a line-like structure. I am correct? It is forming a line, but this line is not straight. It is like a teeth, right? Henceforth, this line which is formed by these anal valves is called as the pectinate line, or otherwise you can say it as the dentate line. This is called as the pectinate line or the dentate line. Now, there is one major anatomical, like notch which is seen here, right? This and this, right? At the level of this notch, there is also another line like this. There is also another line like this, which we call it as with other name called as white line of filter. This is called as what? The white line of filter. So in the interior of the anal canal, you are seeing the anal columns of Morgagni, which are 6 to 10 in number. In between the anal columns of Morgagni, you are seeing the anal sinus, and along the lower border of the anal columns of Morgagni, you have seen the anal valves, otherwise called as valve of Bell. And all these valves together formed a line called as the pectinate line or the dentate line. And there is also some other line in the lower part of the middle part of the anal canal called as the white line of filter. Right? So these are all like different zones which you see in the anal canal. Now I just wanted to label this one as the anal sinus. This is the anal sinus, and this is what the anal column of Morgagni. Now let us see about this upper zone. Interior of the anal canal is the upper zone. So I will start from here. If I start with the upper zone, I will write it here. This is very, very important for you for MCQs and also for NEET. Now comes the important part. In the interior of the anal canal, that is in the upper part of the anal canal, basically you will be seeing this interior is composed mainly of mucosa. So henceforth this is called as the mucous part of the anal canal or the mucosal part of the anal canal. So the upper part of the anal canal is called as the mucosal part of the anal canal. In this mucosal part of the anal canal, you will be basically seeing simple columnar to stratified columnar epithelium, right? Here you will be seeing simple columnar epithelium to stratified columnar epithelium. So the upper part of the anal canal, in the interior of the anal canal, the upper part of the anal canal is called as the mucous part or the mucosal part, which is mainly composed of simple columnar to stratified columnar epithelial cells. That's it. Okay. Now we will see the middle part. This one, right? This is the upper part. Now we will see the middle part. Now coming to the middle part, I will write it here. This middle part is basically called as the transitional zone. This is called as the transitional zone. Why it is called as a transitional zone? Because it is lined by stratified columnar, but something special, non-keratinized epithelium. So it is lined by stratified columnar non-keratinized epithelium. And this middle part of the anal canal is devoid, D-E-V-O-I-D. Devoid means it does not contain. Devoid of any sebaceous glands. Or these glands, white glands, right? And also, this middle part of the anal canal is the region, yesterday already I told you, which contains internal rectal venous sections, right? So this is the importance of the middle part of the anal canal. Now coming to the lower part. So in the lower part of the anal canal, now it is called as the what? Cutaneous part of the anal canal. So this is a cutaneous part of the anal canal. Otherwise, it is also called with some other name called as the anal verge. Okay? And this cutaneous means what? Skin, right? So this is lined by what? Stratified columnar keratinized epithelium. So this is the difference between the three zones of the interior of the anal canal. Okay? So now coming to the next part, that is about the blood supply of the anal canal. To show you the blood supply of the anal canal, again, I will just, no, I also wanted to show you the interior. Next, further interior characteristic features of the anal canal. That is about the internal anal sphincter and the external anal sphincter, right? To show you the internal and the external anal sphincter, again, I'm just taking this one diagram. One, and this is the anal canal rectum. So here is the anal canal, right? One, this is called as what? The white line of Hinton, and this is the lowermost part, right? White line of Hinton will be lying here, right? So now let us see about this anal canal interior. That is the muscular layers of the anal canal. The anal canal of the large intestine, you know very well that it contains the inner what? Longitudinal muscle cord. మరి చెప్పాలి మీరు డిస్కషన్ చేసుకుంటే సరిపోదు. ఏం తెలుస్తుంది? ఇన్నర్ లాంగిట్యూడినల్ మజిల్ కోడ్ చెప్పండి అంటే మా వాయిస్ అంటే కొంచెం చెప్పడు సీరియస్ చెప్పాలి. సో ఇట్ కంటైన్స్ ద ఇన్నర్ muscle, right? But see, at the level of this anal canal, right, in the upper 2/3 of the anal canal, you can see that this inner circular muscle cord has thickened, right? Become thickened, and this thickening will form the internal anal sphincter, which is involuntary, right? Now, again, I just wanted to continue this diagram. External to this inner circular muscle cord, there is another layer of muscle cord called as the what? The outer longitudinal muscle cord, right? This outer longitudinal muscle cord will go and merge with the fibers of another muscle here called as the levator ani. So these will go and merge with the fibers of levator ani muscle. Once it merges with the fibers of levator ani, now you can see they both together will form another muscle cord here. And this muscle cord which is formed here is called as the conjoint muscle cord. Conjoint muscle cord. I am just drawing on either side. This is called as the conjoint muscle cord. Okay. And this conjoint muscle cord, as it comes to the level of white line of Hinton, it will split into two divisions, two layers. One is going towards the medial side, called as the anterior intermuscular septum. Anterior intermuscular septum. And the lateral one, which goes like this, forms a fascia called as the perianal fascia. Perianal fascia. In the next diagram, I will be drawing this with a green color. Okay. So now I am just completing the diagram here. This is called as the anterior intermuscular septum, and this is called as the perianal fascia. Right. Now comes to the external anal sphincter. The external anal sphincter is again, you can see, it is formed by the longitudinal muscle cord, but it is not in the form of single muscle, but rather this external anal sphincter is in 3 layers, 1, 2, and 3. See, now you can see that I also draw it here. 1, 3 layers. So this external anal sphincter is in the form in 3 zones of 3 layers, where we call this one, the innermost one as the deep external anal sphincter. This one is called as the superficial external anal sphincter, and this is just below the skin. So I will call it as the subcutaneous external. So this means that the external anal sphincter has got 3 parts, namely the deep part, superficial part, and the subcutaneous part. Right? Now, after this is, I just wanted to keep this anal parts of organ. Right? Okay. So with this now I have even told you about the muscular layers of the anal canal. I am just extending this one, right? So after this, let me just label them before I go further. This is what is what? Inner circular muscle cord. Okay. This is the outer longitudinal muscle cord. This is levator ani muscle, and I wanted to label this as the what? Conjoint muscle cord, and I wanted to label this one as what? Perianal fascia. This is called as what? The perianal fascia, and this is called as the anterior intermuscular septum, right? I hope I'm clear with everything, right? Now the thing is like, let us go to the blood supply of this rectum. If you look at the blood supply of the rectum, you can see that there is one artery which is coming from above called as what? The inferior or the superior. Called as what? The superior rectal artery, which supplies like most of the anal canal. But if you are attentive and if you observe, I have ended that artery at one line, above one line. What is that? Pectinate line, right? Now this is the like superior rectal artery, right? Which is from the which branch? Inferior mesenteric artery, right? Now I just wanted to keep another artery here, which is coming from above the levator ani. Now you can see it is crossing, and it is also supplied here. It is also supplied here, but this is also supplied somewhere above the line of that is the pectinate line, right? So this means that both the superior rectal artery and the middle rectal artery are supplying the anal canal only up to the level of pectinate line. But now coming to this middle rectal artery is a branch of internal iliac artery. Now coming to the last one, that is the internal pudendal artery. This internal pudendal artery now comes and now it is supplying the interior of the anal canal only up to this level. You can see, right? It is supplying only up to this level, right? Which means that this inferior rectal artery, which is a branch of the internal pudendal artery, is supplying the lower half of the anal canal, but below the pectinate line. This is why the pectinate line is called as the watershed line. Okay, so this means that the pectinate line is the main differentiating character or the point for these arteries. Along with this, you also know that there is a venous drainage which goes from the superior rectal vein, and this is the middle rectal vein, and also you know that there is inferior rectal vein. But now you can see that this inferior rectal vein is forming some flexures. This is very important. This inferior rectal vein is forming some flexures. These flexures are called as what? The external or internal? External rectal venous flexures. These are called as the external rectal venous flexures, right? And now you know which vein is forming the internal rectal venous flexures, right? If I have to extend this one, now I can keep here. This is nothing but what vein? The middle rectal vein is the one which is forming the internal rectal venous flexures. So I will label it as the internal rectal venous flexures, right? So I just will write it as what? The superior rectal artery. This is the middle rectal artery. This is nothing but the inferior rectal artery, right? Okay. This is all about the blood supply of the anal canal. But now there is something very important, which is an important component of this anal canal, that is the ischiorectal fossa. So how to understand this ischiorectal fossa? Already I just wrote something, right? Lithotomy position. Hope you all have seen that in the images, Google images. That lithotomy position is basically used to deliver it, to conduct a normal delivery. Sir, normal delivery, the pregnant can lie down and you can deliver the baby. Why only lithotomy position? The problem is like these days you generally hear some word called that lady had a very big baby. She delivered a big baby.